You're listening to In Your Pants with Dr. Susie G, the physiotherapist for your privates, helping you get in the know down below.
Hey guys, it's Dr. Susie G here, and welcome to another episode of the In Your Pants podcast. I'm so glad that you're able to join us today. We've got a good one for you, so perk up your ears. Because today we're talking about sex ed myths and myths around expectations, around lasting longer in bed and orgasms. We also talk about the topic of intimacy, and we end up chatting about orgasms and where orgasms come from, what's the definition of an orgasm, and some things that can influence our experience of an orgasm. And to help me do this today, I have a very special guest on our show, Dr. Uchenna Ossai. She is a pelvic health physical therapist and sexuality educator and a certified sexuality counselor. She's actually the only Black physical therapist in the world with this designation. Dr. Ossai is the creator and founder of UC Logic, spelled UYOUSEE Logic, a sex education platform that's dedicated to improving the sexual intelligence of adults through innovative content and honest discussion that is free of judgment. Her video series, Bourbon Tales, is where she answers questions about sex, the pelvic floor, and everything in between while sipping on her favorite bourbon beverage. During the day, Dr. Ossai is an assistant professor at UT Austin Dell Medical School and manager of the Pelvic Health Physical Therapy program at UT Health Austin. She also serves as adjunct faculty at University of Michigan School of Social Work Sexual Health Certification Program. I am so excited to present this episode to you today. I hope you enjoy it. Kick back, relax, and maybe grab your own favorite bourbon beverage. Hey, Dr. Ossai, thank you so much for being with me tonight on the Ants podcast.
Thanks for having me. I am super stoked to chat with you all tonight. Thank you. I feel so honored to be a guest.
Well, we've got some really big topics on today's agenda. Lots. We do. And I think I'm going to start it off with something that you posted recently on your Instagram page, which, by the way, everyone, it's fantastic. So if you ever, if you're on Instagram, which you probably are, go ahead and follow UC Logic because she's awesome.
Thank you. I appreciate it. It's a labor of love. It really is. It's a labor of love, and it's super fun.
Awesome. So you talked about intimacy, and there was a specific segment that you were listening to when somebody was describing, what is intimacy?
Yes.
What are some of the myths around intimacy? Because I can imagine that there's a lot of misconceptions about intimacy and our beliefs about it.
Yeah. The thing about it is everyone thinks that intimacy is this feminine construct, right? It's just truly not, right? And I was listening to sexologist Shamira, so y'all should hear her. She's dope, woman of color, Black woman who's a sexologist therapist, and she just drops truth bombs every single day. And she was on this YouTube interview talking about intimacy and talking about how really intimacy is about being seen and being heard, right? And being and having that reciprocity in that process. And it's not just in romantic relationships, right? It's in your friendships. Because I think for me, fundamentally, when I'm listening to a lot of my clients and patients where they're coming to me with sexual problems, really they're having intimacy problems where they don't feel like they're being heard and they don't feel like they're being seen, right? And then their partner isn't feeling that as well. Right. And it's really the primary barrier. It's not sexy time. It's not the doing it that they're on the struggle bus with. They're on the struggle bus with intimacy. And I was all kinds of shook because she was just saying it's really about really being vulnerable enough to tell this person that you're not being seen, to tell this person that you're not being heard, and then having that space and being able to receive that for your partner or partners, however you swing, right? And being able to receive that and say like, yes, I hear you. Yes, you can be vulnerable. Yes, you can be raw with me. And yes, you're safe in doing that. And I'm not going to love you or appreciate you less. And that is intimacy, right? And like also like with my recent post, I said, you know, how we view sex, how we experience sex really has a lot to do with the life that we are living in, the life that we experience. It's not just about hard penis, wet pussy, tight ass, right? Like that's just, and like I said, it's helpful. Like that's super fun, right? But that's just one piece of it.
Right. And it sounds to me like you're talking about acceptance. Like you're talking about one another accepting each other for who they are and what they bring to the table without judgment.
Right. And you know what? Like, let's be real. Like, we all judge. We judge the hell out of ourselves. We judge the hell out of each other. And like, you know, my platform is like, judgment free. And it's not really about like void of judgment, but it's really about understanding where that judgment comes from. Right. Because it's not about the other person. It's really about us. It's really about ourselves. And that's really about, that's what sex starts from, is you individually, right? It's not about, you know, yes, it's about the other person, but first you have to be comfortable in your own skin, right? And like when you have people who are living with pelvic floor issues, pain, whatnot, like your sense of self and your sexual individuality and identity kind of gets all jacked up a little bit. And then it's hard to proceed forward. It's hard to be vulnerable. It's hard to be intimate because you're not understanding what's happening within your central core.
Right. Yeah. And that's really hard. And that's a good point that you bring up about having, you know, issues down below, which not many people just to even talk or have this kind of conversation that we're having, Dr. UC. I mean, let's get real. None of us talk about it. None of us feel comfortable to be vulnerable to talk about these things, and nobody's really asking, you know, and we're in our own world constructing what things should or should not be based on what? Based on, you know, society and cultural expectations.
Yes. You know? Yes. All of the bunny ears, right? Because it's like, girl, I mean, I am very Black, very Texan, very first generation American, very Nigerian, very educated, plus sized, PT, liberal AF.
You go, girl.
That totally informs how sex is experienced for me and for my partners, right? Like and everyone thinks like, oh, like, why do you have to define those? Why do you have to put that? Because that comes into my bedroom, right? That comes into everyone's bedroom. And there's nothing wrong with being who you are, but like understanding that sex is so much more than like what porn has educated us on, right? Because porn ain't no education, it's entertainment. And it's totally cool, totally fine, but it's not an education.
I'm glad you brought up porn because I want to pick your brain on this. Or get
sure, take it away.
Like, I feel like, well, I work with a lot of men, younger men. Yeah. I mean, and women, you know.
Yeah.
But I feel like this day and age, there's a lot of younger individuals who are struggling with that, not just intimacy, but also with the expectations of performance.
Yes.
Right? Like, can we talk about that? Like, what are some of these myths? What are these quote unquote expectations? I should be performing this way. I should feel this way. Orgasm is, you know, what do you have to say about that?
Oh God. Yeah. Oh, Lord help me. Right. And I'm not even religious. And I'm like, fix it, Jesus. I have to say that, you know, and I'm making light of it, but really it's very serious and it's very demoralizing, right? Because a lot of young men that I've seen, you know, and older gentlemen, men of all ages, have the expectations that their penis should always be like up and ready to go, that they should be able to last forever, right? That they should be able to give their partner that their partner's orgasms are their responsibility. Not true.
Good.
Not true. Okay. Well, and we'll talk about that in a sec.
We'll get there.
We'll get there. But, you know, like,
don't come too fast.
Right. Don't come too fast. Don't come too long. Like, it's like, and then it's like, oh, she likes it rough, or he likes it rough, or they like it rough. And then it's a matter of, oh, it can't be soft. It can't. Sex, look, sex really is, if you're having partnered sex in particular, that's supposed to be a mutually pleasurable experience, right? It's not just about the dude getting off, or, the lady getting off, or the gender non-conforming person getting off. It's really about people getting to their pleasure and experiencing their pleasure, period, right? And there is no specific way that has to happen, right? We've seen, I love me a good romantic comedy, but I feel like they have ruined us for sex because it just sets up this unrealistic expectation that the, cisgender white dude is going to climb on top of the cisgender white lady, and they're going to like touch bellies for 20 seconds. Great music is going to happen. And then, orgasm, right. And, relationship sealed. Nope, that's just, and even though we know logically in our brains, that's not reality, that's all we see. Right. All the time, right? So in our head, that's the expectation we're bringing into the bedroom on top of what we're seeing, because no one's sitting down around the table and being like, hey, Dad, what about premature ejaculation? Because I was hooking up with this person the other night and I came before they were ready. Well, actually, that's a common thing.
Right, exactly.
That's a common thing. And you need to know, like, when you're feeling that peak, that rise, and you need to slow down the touch. You need to calm down your pelvic floor. You need to kind of touch another area that's stimulating, but not super stimulating. Redirect, and then build it back up when both of you are ready to go back into it again. Like, totally normalizing that. Exactly. And saying, here's how you adjust that. And it's totally okay. It's not a place of shame. Right. It shouldn't be shameful.
Exactly.
It happens.
Exactly.
Like premature ejaculation and ED are two of the most common sexual dysfunctions among cisgender men.
Yep. Yeah. And what about performance anxiety? Let's not forget that, because, if you're scared, you've got a hot day, you don't know what's going to happen, you're worried, and now you have to perform. Boom.
Yes. Or what about if your boo is going through fertility stuff?
Yes.
Right?
Totally.
And you have to be like, there's a clock, the temperature is right. I got that's intimidating. That makes my stomach hurt. And I don't have a penis, and I am a cisgender female. Okay. That makes me stressed out. So I can only imagine, what that would be like for somebody, going through that process. So I think we are all allowed to have variability in our sex life. There is not just one way to look at it. And it's going to be fluid, right? What felt good to you when you're 19 ain't necessarily going to feel good to you when you're 25.
That's right.
26. Bodies change, life happens.
Right.
Right? People say, like, why don't I like this anymore? And I'm like, well, you went to grad school, or you had kids, or you got married, or you had an injury, or, life happens. And so your sensibilities and sensitivities and your pleasures are going to change.
Right. It's a spectrum, and it's going to be variable at any given moment. And I think that's, like you're saying, there's an expectation that things don't change, or they shouldn't change.
Yes.
And we're really afraid of uncertainty, and we're really afraid of that change, either holding on to things being the way they are in the current moment, or being really like pushing away something that they're not ready to handle or want to deal with. Absolutely. And I think, like going back to porn, because I literally think I took us like around the block. Sorry about that. but I think when it comes to porn, porn is not shameful. Yes, like I'm coming out with this document in the next couple of weeks about like how, like, the perfect porn. And it was like content generated by like my followers, and basically, like, a lot of porn is problematic because it's very misogynist. It's very patriarchal, right? It's kind of like bam, 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 bam. And it's not looking at the full spectrum of sexuality, of gender, right? And I think that's the problem with porn. It's not that porn itself is problematic. And also, for those of you out there, if porn does not fit into your value set, that's fine. Mm-hmm. That's fine.
and it's okay. It's just that so many people default to porn because that's the only sexual outlet, that's the only sexual input that they have.
Right.
And I'm not saying go out and watch porn. I'm just saying here are some of the challenges we have with porn because it's an incomplete picture of how sex and gender work. That's all. Right. That's what I'm saying. And it misguides people. So then they attach their expectations on their real life partner or partners based on their experience with porn. Mm-hmm. And it's an incomplete picture of how life is. That's all.
I like that. An incomplete picture. Exactly. Yeah. Oh, and thank you for normalizing a lot of those common things you were mentioning: premature ejaculation, ED, performance anxiety. I mean, you're totally right. I mean, if we just normalize these things, because we're all human, we've all experienced, shame around our body parts at one point or another. And it's hard. I mean, it's hard. It's sometimes, being human is messy.
It's so messy. It's funny. I, recently, with an ex-boyfriend, and I hope he's fine with me saying this, but we were talking about sex and gender and body parts. And he was like, yeah, for a long time growing up, I was worried about my penis size. And I'm like, is that, and I'm a grown woman who does this for a living. And I'm like, really? That is a legitimate concern. And he's like, yes, and he's like, it took me a long time to accept my body and accept that. And it's the same thing with women, right? Women are like, oh, my vulva is not pretty. My vagina is not pretty, or this or that. And I think that genital body image is a factor in a lot of this. We have to accept our bodies as they are or love ourselves. And it's okay if you decide, hey, I need to get that changed. I need to have some plastic surgery. That's fine. Because, there's nothing wrong with doing that either. But our genital body image totally impacts our sexy swagger. Hardcore. Totally.
And that goes into my next segue into orgasms, right? I think what you're saying has a lot to do with what our experience of orgasm is. So let's kind of talk about, okay, what is an orgasm, and what are some things that can influence one's experience of an orgasm? Because I feel like there's a lot of people out there that have this expectation it should be or feel a certain way.
Yes. So long and short, y'all, an orgasm is an individual experience. So you'll look at research articles, books that'll all describe orgasms as a culmination of pleasure. You'll feel contractions in the pelvic floor. You'll have ejaculation. You'll have, vaginal lubrication. You'll feel this feeling of euphoria and glee, all of that. Everyone will say everything under the sun. Mm-hmm. And I just say an orgasm is basically the UC logic or the UC definition of it is basically the culmination. It's almost like the peak of pleasure in that moment, the peak of sexual pleasure in that moment, right? And that peak might be angels are actually weeping over you, or that peak might be no angels, felt really good. I felt it higher, but it's still pleasurable, right? And that's the orgasm, again, like we talked about earlier, it's on a spectrum. And I think that's what an orgasm is. Now, one thing I will say in terms of the gender component, because we have to talk about this, and I know people kind of roll in their eyes, be like, why are we talking about gender again? I mean, because it's so different. We've split our culture into this binary system of man, woman, and it's not. And we've spent so much time encouraging young boys to masturbate and understand their pleasure, right? So they're always going to be looking for their pleasure. And we spend so much time telling young women, hide your pleasure. Don't be a hoe. Don't get pregnant, right? Be chaste. Be pious.
Close your legs.
Right? So there's no celebration of the pleasure or masturbation for that when we're thinking of a binary for women. Mm-hmm. So then, then you spend all those years kind of learning each other and fumbling about, and the young man has the cultural authority and go ahead to just prioritize his pleasure. And the woman does not. And, you know, you have some people that strangle through and find it, you know, like, but then you have others who don't.
Right.
And then you have other males who actually don't either, even though we have this cultural permission, right? And that could be for a multitude of reasons, right? So when we're thinking about that, we have to kind of understand it from that concept. And also, again, we assign the responsibility of the orgasm, especially in heterosexual relationships, to the man, right? Man's going to give the girl an orgasm, or the girl, you know, and then, or vice versa, the girl's going to give the guy an orgasm. And that's not how it works.
Right.
That's not how it works.
Yeah, because I mean, really, where did these beliefs, these expectations, I mean, it's like, nobody really questions them, you know? It is what it is. This is what's supposed to be like, but who says? Like, where did that come from? Who says?
Yeah, and it's funny because, like, if let's say like you're Joe and I'm Sally, you know, you're like walking down the street.
Sally.
Hey, what's up? Oh wait, you're Joe. I'm Sally. Hey, what's up? But how are you supposed to know, like, what is my pleasure?
Yeah, right.
Seriously, because my body is not the body that you saw in that porn last night.
That's right. That's right.
And my experience of life is not the experience of life that the porn star actress had. Mm-hmm. And also, she's acting.
Exactly. Yeah.
So how is what is done to that actress going to be pleasurable to me? Mm-hmm. But because historically, and again, I'm kind of pulling from a giant stereotype here. Historically, if I, Sally, am not allowed or haven't really been taught or supported in exploring my pleasure, I'm just kind of go along with Joe does.
Right.
And be like, feels good. Sure. Yay. Mm-hmm. Love that. You know, or I might accidentally stumble upon it and be like, oh, repeat that. Do that again.
If you're lucky. If you're lucky.
And I think that's a really interesting concept. And that's why I started UC Logic. I really just started UC Logic to model how people can ask questions and be validated in the questions, because we all think that sex education stops when we're 16. And that's just not the case.
Oh,
right?
No.
That is not the case. I am a grown woman in my mid-30s, and I learn stuff every day.
Yeah. Well, and we're always in that, because we're always changing, and it's always good to check in with oneself, like explore and absorb here's the thing. I tell my patients this, you know, like when you're touching one another, like, for example, this is mostly in the context of, I should give a context of pain and getting back to feeling safe in one's body with context and your partner, and communication. Yep. Again, it's communication, and it's lessening the threat of the situation, right? Because it's once bitten, twice shy. Right? All it takes is one episode, and this goes for all walks of life. You know, if something doesn't feel good and it's associated with something that used to feel good, that it's like Velcro.
Yep.
It's like Velcro. So it's when you get back into that and trying to feel safe in one's body or with this relationship or context, it's really important, A, to feel in control of the situation, and B, to be vulnerable, to express to oneself, like, this is okay, this is not okay, but also know what it feels like for you. Because oftentimes when we're doing things to ourselves, it does not hurt nearly as much as if someone else were to do something to us.
Absolutely. And can I just testify, preach, Dr. Susie, but can I just add another thing too, particularly in the context of your male pelvic pain patients, is the importance of grief, addressing grief when you have pain, when you didn't always have pain, right? And I say grief, you know, not in that it's a loss of human life, but the grief of, like, the loss of spontaneity, the loss of self-efficacy, right? That loss of being like, that loss of control that you used to have. And it's not saying that you're not going to get it back, but I think in the process of healing, we have to kind of acknowledge, you almost have to use the actual stages of grief when you're thinking about this, right? It's because depending on your pain, it could be your pain starts with arousal. That sucks, right? Or it could be your pain starts once your penis gets erect, or once you get in the middle, get going, you know, whether it's penetration or non-penetrative sex, right? It's almost like this demoralizing process that used to be this sacred, pleasurable moment and now has been infiltrated by this pain.
Right. Exactly. That's such a good point.
You know?
You see. Yeah.
Oh, yeah. Because once we acknowledge that, once we say, okay, this sucks, I'm grieving through this, then you can actually map out a plan to each stage and be like, okay, what can I do here?
Yeah.
You know, did I always have super spontaneous sex? Right? Like, can we kind of like, you know, pull down some myths here? And this is where sex education can be wildly helpful, or sex re-education.
Exactly. Re-education, because what we've been educated was nothing.
Was nothing. It was trash. We all know it. Like I told, like if it wasn't for my mother, like I told my mom either, I was like, Mom, I would be lost if it wasn't for your weird liberal, hardcore Catholic ass. And she was like, what? Darling, that's wonderful. Thank you. You know, I was like, great. You know.
Oh yeah, and again, it is so important. So on that topic of myths, so
yes,
if we didn't touch base on it already, is there one myth that in particular gets underneath your skin that you really want to convey here tonight?
Oh my God,
I know there might be a lot, but
okay, so there are kind of two. I mean, one we already talked about that. An individual is responsible for the orgasm of their partner, because you're not, and also that sex is supposed to last like forever. That, and I'm speaking, you know, primarily from a male perspective, because this was a huge cause of distress for a lot of my patients. Is that they had to perform for 20 minutes straight. And I'm like, well, the average sexual encounter lasts 6 minutes. So I don't know where you're getting that from. Right? Maybe it might be that you and your partner might want to explore more outer course options and things and expand your sexual treasure chest. But I think those two myths are really challenging. And when I tell people your orgasm is your responsibility, not your partner's, they look at me like I have 45 heads. And it's because, like we talked about earlier, I can't expect you to read my mind and know my body. That's my responsibility, to know my body and to communicate to you that this is what I need. This is what I like. And ipso facto, you can be like, oh, have you tried this? And you're like, no, I haven't. And I like that, you know? And it can be this like sharing experience versus like expecting this person to know every like button to push.
Right.
You know, and it's not always like that. Like we all come in with a certain level of skill, right? Some higher, some lower, you know, and that's fine. Right. But then we have to kind of adapt to one another. Right. And explore that. And I think that's where I say ultimately for truly pleasurable sex, long-term sex, you know, both people need to know themselves, know their bodies, and be able to sexually communicate.
I love that. And so for anyone out there who's maybe, you know, because there might be some shyness or reservations of how do I bring this up with my partner? Right. What's a soft startup? What advice would you give to someone if they're wanting to kind of take this approach that we're talking about?
Yeah.
How do you bring up that conversation? How do you open up the dialogue?
Absolutely. So I always tell people like a really nice, gentle way of doing it is pleasure mapping. And you can introduce pleasure mapping as like a new sex game that you want to play, right? Where you can put genitals on the table, you can take it off the table, and you both just like map each other head to toe and explore. And you give each other a set amount of time. Like say, okay, you get 15 minutes. And if you have boundaries that you have in terms of how your body is touched, you explicitly state that. Be like, don't touch this, don't touch that. Cool. And then you do 15 minutes. You guys communicate. During that time, you explore each other's pleasure and you switch. And then afterwards, you debrief. And that's actually a great way to be like, oh, you know what? I thought you really liked that. And be like, you know what? I really love when you do this, right? Instead of being like, no, that was trash.
Right.
you say, oh, I really loved it when you massaged this way. God, and I loved when you gave me firm pressure. That was awesome. I could have ridden that train all night, right? That's a great way to kind of, especially if you're not quite comfortable with, because I think that our direct communicators out there are cool enough to are cool with sitting down and be like, hey, baby,
Right.
like, I want to try something new, and be like, oh, okay, great,
Right.
But then for people who are a little bit more shy, this is a great way to kind of just introduce a new sexual game where the purpose is just like exploring things. Like, let's try something new. And you can try with you guys can decide. You can use feathers. You can use whipped cream, just around the genital area.
Right.
It's sticky. But you know what I'm saying? You can explore
without
this.
pressure.
Choose your own adventure. If you don't feel comfortable being naked, have underwear on. Whatever, just be in your comfort zone. Right? You can be mostly clothed if you want.
Exactly.
Honestly, it's just a matter of finding your pleasure, starting where you're comfy.
That's right.
And I think if you can think individually, first off, where am I most comfortable? That's where I would start, is really be honest with yourself. Because some of my patients and clients realize, hey, I'm not even comfortable being naked in front of my partner. And something as simple as putting on a bra or having a skirt on or some type of cover over their lower body totally changes their sexual experience, because it's kind of eliminating the visibility of the area that they don't feel good about.
Right.
Right. And so really start with kind of do your own body check and just be what am I feeling comfortable with here? Right. And sometimes you might realize I might feel comfortable with my body, but I'm not sure how my partner feels about my body, and then that's a whole other beast. Right. And that's something where you can decide, okay, I'm going to kind of tell my partner, hey, I'm a little insecure around you, or I feel I don't, I'm not feeling my best. And they'll be like, oh, you're beautiful. You're this, or you're so handsome. Or that might not be their style, because everyone's partner is a little different. So you might have to change the environment a little bit. If you want the lights off, if you want the lights on, or you might get some help with a couples counselor that can help you with sexual communication and exploring that a little bit more.
Oh, I love that. Speaking of couples counselors and counseling,
yes.
How if the listeners wanted to get in touch with you, follow you, I know you're busy doing lots of things, what's the best way to connect with you?
So the best way is honestly DMing me or checking me out on my website and sending me a message through my website, because I do individual counseling. And so my counseling, since I'm not a mental health provider, I'm not a sex therapist, I do not provide intensive mental health therapy. So I don't address trauma, but I do counsel people and giving specific suggestions, sex education counseling. And sometimes that can be a wonderful bridge to sex therapy, or it can be people who don't really need sex therapy, right? Because they don't have those deep-rooted intensive mental health issues to work through. But really, they just need some guidance on how to kind of navigate sex based on, their personal experience. And it's really, really great. You don't need to see me for forever and ever,
right.
Amen, right? But it's a nice way to kind of help you catapult your sexual adventures in a safe way with someone who knows what they're doing.
That's right.
And is certified to do it.
Yeah, well, exactly. And sometimes all it takes is some quality knowledge, right? To put a lot of these fears and these worries that we hold on to and we carry, we think about not just one time a day, but let's get real. We're thinking about these things all the time, and even on a subconscious level. So really, I think putting your worries aside and getting some quality information and using that to kind of catapult, like you said, your progress, your experience for yourself, with your partner, or whatever that may be. So, oh my God, this was great. And then I already mentioned your Instagram page, UC Logic. I'll connect everything to the show notes, your website, all of that. So guys, ladies, gentlemen, penises, vaginas, uteruses, whatever. Connect with UC. It was such a blast having you on the show. Thank you so much.
Oh my gosh, thanks for having me. I love chatting with you, and I cannot wait for us to collaborate in the future.
Likewise.
Thanks for listening to today's episode. Be sure to head on over to drsuzyg.com where you can get more information, show notes, and related articles on today's topic. Also, if you like what you're hearing, head on over to iTunes, subscribe to the podcast, and leave us a rating and review. We'd love to hear your feedback. Thanks again.